No one investigates like News 4. The painful consequences of prescription drug abuse can tear a family apart. We've been covering the growing epidemic for years. And tonight, News 4's Nalina Shapiro shows us one local doctor who is taking drastic steps to find out if his patients are abusing their medication.
Dr. Eugene Gossi founded New York State's largest pain management clinic in Williamsville. He says for some people, he's a lifesaver.
We hear testimonials that we're the last stop, and the patients would either jump off the Grand Island Bridge or do some other harmful things to themselves because they do not want to live like that.
Dr. Gossi's 13-year-old clinic sees up to 10,000 active annual patients. 90% of them are on some type of opiate-based drug to help them manage their pain. Recently, Dr. Gossi contacted us saying he had decided to take drastic action with his patients to prevent them from abusing their meds.
As the drug seeking is becoming more and more sophisticated, so is the monitoring.
Gossi's new protocol requires patients to agree to random drug testing of their urine once a year. This tells them if they are overusing, in which case he'll find them treatment, or not using at all, which may be a sign they are selling the drugs illegally. What happens if a patient refuses to be tested? He drops them.
We'd like to ensure that prescriptions are given for the right patient, for the right reasons, and being used for that purpose.
Cheryl Plasek wishes that her son Daniel, a 28-year-old Navy veteran, had been monitored more closely when he was seeing Dr. Gossi for back pain.
He was prescribed an opiate, which I never even knew what an opiate was.
She says he became addicted. That's when Dr. Gossi reportedly put him on Suboxone, which is used to treat opiate addiction. But Cheryl says by that time, it was too late.
And that's when the problems began even more, is when he went into withdrawal. We could see upon withdrawal that the suicide thoughts were there.
Last January, Daniel ended his life while a patient at the Veterans Administration Hospital.
That first night, he was there. He hung himself in the building.
She's upset with the practice and thinks that it's the medications and the prescriptions that led to his suicide. What is your response to that?
Well, I'm sorry about the loss.
HIPAA laws prevent the doctor from addressing specific cases, but he said in general,
The medications are, if monitored, prescribed correctly, tend not to be the source of all evils. Such bad outcome, I suspect, that is due to a multiplicity of factors.
combating prescription painkiller abuse is an ongoing battle in Western New York and across the country. Here at News 4, we have covered the topic extensively, and we know at times it can be controversial.
They use a myth kind of warning.
Avi Israel also lost a son to suicide after he became addicted to prescription drugs.
We've lost our kids, you know, and hopefully we're making an impact, we're making a change. Now it's up to doctors to do their part.
Doctors, parents, and law enforcement do agree on one concept that will be an important preventative mechanism for prescription abuse: I-Stop.
It gives them the ability to take the patient's name, run it into the I-Stop system, and ensure that that patient is getting the medication in a proper format.
I-Stop creates a real-time online database for doctors and pharmacists to report and track so they know their patient's history. More information could lessen the opportunities for abuse.
Just use more discretion in what you're prescribing them for. And my son never had a surgery. He had back pain. And now we visit my son in the Gate of Heaven Cemetery.
Nalina Shapiro, News 4.
If you want to see exactly how the I-Stop program will work, we've broken it down for you on WIVB.com.